Yo, 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 everybody, what is up? Welcome back to another episode of and hopefully one of your favorite podcasts, the What Now podcast. What's up, Zach?
What's up? What's up? What's up? It's definitely one of my favorite podcasts. Slightly biased though.
Yeah, it's pretty fun, dude. This has been I think it's been like a good outlet for us. And I think it's just been interesting just to like kind of think about how, dude, we've really been recording this like since we've opened for the
Mm-hmm.
past 2 years. And that's been pretty cool. A lot has changed, a lot has
100%.
stayed the same. New in your practice.
What's new in our practice? I wouldn't say a whole lot. Think I've mentioned before on the podcast, I was such a taker in of information that I was trying to change stuff regularly on the in the practice. And so I was like, you know what, let's keep things the same in some facets. So that would be one thing that is new is just staying consistent and letting that build. I will say one thing that is new is we're really working on our day 3, day 4 process, which I know we talked was a big takeaway from Growth Summit, but we've really been nailing down our day 3 and our day 4. And even in like 2 or 3 weeks of implementing, it's been huge for our patient flow, which has been great.
Yeah, can you just like for people who are like hopping into this episode, give
Mhm.
like what does day 3 and day 4 mean? Because in some circles, like you
Right.
don't do the care recommendations until day 3. And
Yeah. So,
so
so for us, really quick, day 1 is for not to go into too much depth. That's our exam. That's our
consult and exam.
scans, consults, relief adjustment. Day 2, full spinal adjustment, report of findings, financial conversation, and then scheduled out from there. And then day 3 is really their first like regular visit, if you will. And so what we realize is we just kind of greet people at the door. Hey, welcome in. You can take your shoes off, and then it's just like boom.
Mhm.
That's what it was before. But we do have wobble discs in our practice. I have a whole mobility section, and so now, thanks to Dr. Austin, what he shared, we actually do a let me show you day. So that's our day 3. So let me show you what to do on your typical visits. So our CAs will literally take off their shoes with them. They'll walk them to a wobble disc on the chair, show them how to use the wobble disc, sit with them for 2 to 3 minutes. And what's been fun is I've even started to allow the CAs to just take a look. Hey, look at what they're coming in for. What's their chief complaint? I haven't given stretches yet, but they know the stretches I recommend. And so if someone's coming in for shoulder and neck pain, our CA will just say like, hey, here's a simple stretch that you can do as well after you finish with your wobble disc. And then Dr. Zach will call you over. And so that's already helped the flow of the practice. And then day 4 is let me watch you. So we just want to make sure they know what they're doing and still handhold them through and not just assume because they've been to our office 1 or 2 times that they know what to do. And so that way we start to incorporate that rhythm and really allow that flow to be nice and optimal. And I will say, as like a more on the pain preventative side of things, I do notice a difference in adjusting patients that do the wobble disc prior to their adjustment and don't. It just makes for a much smoother adjustment.
Yeah, Kate and I have been kind of like going back and forth between that because we were like, what are we gonna be like, let me show you to like a lot of the parents? Like that our CAs can do because we already like show parents like a lot of stuff like hey
Mhm.
this is like this little tummy massage that you can do or this is like a way to like massage the baby's legs or those kind of things but like to have our CAs do I don't
Mhm.
know necessarily how that would fit and then like I know definitely let me watch you like if you're like hey let me watch your kid then the parents will be like yes of course so yeah, that's good, dude. I mean, I think that's something that we're trying to work toward as well. We have a lot changing right now in the practice, so we're not necessarily switching up any of our systems or our onboarding processes right now. We're kind of in the whole like,
Hmm.
yo, we're just gonna not try to not have everything fall apart right now.
Yeah. Yeah, we just the two like big reasons we implemented it, and obviously in our situation it's a little more like, not that it makes more sense, but there's just
It
more
makes
that
a
we
lot more
can.
sense.
Yeah. Was for one, I really liked what Dr. Austin said was like, you just had you basically roll out the red carpet day 1 and day 2. It's this great experience, and then day 3 rolls around and they just paid you 1,500, 2,500, whatever your care plan costs, and you're like, okay, just welcome into the practice.
Come on in.
And it's like, damn, all right, that's how I'm going to be treated. Um, and I don't think we ever made patients feel that way, but we didn't want that to be like a secondary thought. So that was like a big reason for it, is continuing that handhold process, that white glove, which I think is still one of my favorite episodes that we've done, is talking about like uh, getting on your flight I
Or
think it's
flying
like,
the plane.
yeah, flying the plane.
I think we have 3
Um,
parts. I think we have
yeah,
who's flying the plane, and then flying the plane 1 and flying the plane 2.
yeah. So definitely go back and listen. I think it's like episodes 40-ish,
Something like
30s.
that. Yeah, somewhere in like the middle.
Yep. And then the second reason was we would have people their seventh, eighth visit, they'd come in, they'd just stand at the front, or they'd talk with our CAs prior to getting adjusted, and it would just create this kind of hiccup and lack of flow. And so it is interesting now seeing the few patients that have gone through like the day 3 and day 4 process, how like just so smooth they walk in versus patients that have been coming in for 2.5 years now. And so our CAs have noticed that flow and they're like, crap, we should probably just teach people that have been coming in once a week for the last 2 years how to do this too, because it makes their life easier, makes the practice flow a lot easier. So
Yeah, dude, I think that it's just like really interesting. Well, one to say that like we've been doing this for almost 2.5 years, which is crazy. It's like such a long time and such a short time as well. Like I feel like I'm still like just starting, and
Mhm.
I feel like so much has happened, but so little has happened at the same time. Like so much has changed, but so little has happened. But maybe that's just something that, dude, it's been really productive 2 years for us. So, um, one of the things that we were just talking about that kind of prompted our conversation today was just kind of how things change in terms of like your recommendations, how you like as a doctor get more and more comfortable in like calling your shot, like for like a lack of better terms and stuff, like with your care recommendations or those kind of things. And this is something that Kate and I have been talking about a lot as we go to bring on an associate, is just like how do we teach people what kind of recommendations to give people, right? It's like, because I mean, at the end of the day, you're your own doctor. And like, I feel like, we just talked about being an associate last episode.
Mhm.
And I think that like it should be a thing where like your associates kind of have the framework to be able to make their own decision into what to recommend. But like, where do you start, right? Like, I mean,
Mhm.
do you do once a week? Do you do 3 times a week? But Zach, like, what are you at right now in terms of like how you're giving those care plans, and have they changed since you've opened?
Yeah, for sure. I would say, when we first started, I was still seeing basically the same type of patients, but a lot of our plans were like 5 or 6 months long because that's just what I was taught. And so I would get to like 3 months in and we would accomplish their goals and everything would look great on scans and stuff like that. And I was like, huh, I don't know if people need 5 to 6 month care plans. So we basically condensed all of it to where our biggest care plan that I recommend is 4 months long. So we're about 3 to 4 months of care. Most people are starting off twice a week. Um, that's what I personally have found to be the best. A uh, big barrier of entrance was recommending 3 visits a week with the type of people we see. And so I was like, you know what? Because when I would talk with them, they're like, I can do twice a week. And I was like, great. And so we just broke it down to twice a week for a little bit longer duration, as opposed to like 3 times a week for 4 to 6 weeks. So I would say that's where things have changed, is just learning the demographic and the ideal clients that we're seeing and what works best for them, while also still getting the best results, if that makes sense.
Yeah, I think that's like the very delicate dance. Like you have to walk the line of being like, clinically, this is what you need. Because like we
Mhm.
have some friends that are like, this is what you need. You're either going to come in for it or not. And it's 100 visits, or it's 86 visits or something like that. And then we have some friends that are like, well, here's a pack of 6 visits.
Mhm. Use them whenever you.
Use them whenever you want. And yeah, so I mean, I think that there's like different ways to do it. Like on the end of the spectrum of recommending care is like all the way on one, like on the left hand side, like on one side you have like your walk-in clinic where it's like come in whenever you want, however you want, as
Mhm.
much as you want, or as little as you want. And then you have like the step up from that is like the menu based care where it's like we have these offerings. We have 4 times a month, we have twice a month, we have a 6 pack, and we have a 12 pack.
Mhm.
And then you have your like small care plan office that it's like we recommend like 8 and 12 visits or something like
Mhm.
that, where it's like, yeah, you need 8 visits or something like that. And then like kind of where we fall like right now, I think like is in like our medium, like in the medium care plan visit, we try to keep everything right now. We try to at least try to get people in the door for 90 days. We feel like 90
Yeah.
days is like a long enough time to create enough change in the body.
Mhm.
No matter what frequency you're coming in, like you should be pretty good.
Right.
And then where we used to be in like the PX model, because we were seeing a lot more like super neuro intense cases, is the 4, 5, 6, 7, 8, 9 a year long care plans.
Mhm.
And I think that those have their place. And so we used to give out a lot of those. And then just our caseload just started to change. Like we started seeing babies with like all kind of different stuff. And I love people who are going to be on 36 visits. At the same time, it's not everybody needs 36 visits. At least I don't think.
Mhm.
And so it's like hard, I feel like, to be in a spot as a doctor, especially a new grad, because like you're like, bro, I got bills to pay, like both in the business and personally. And so like you kind of see like it puts you in this like middle ground of like, yes, I need to get you good results. And yes, I also respect your understanding that like you do have stuff to pay for. And like it's not like our care is cheap. Like I think our plans are like anywhere from like $680 to $800 a month is what people pay for, you know. So like it's not like we're giving out $20 adjustments or anything like that.
Right, right.
Yeah, I mean, I think it's kind of like a spectrum, and like I think based off of your demographic, your practice, and your personality, you can fall on either end. Like, you know, like I know our boy John, like in Houston, like he's doing like, hey, bro, you're coming 5 times a week, or I'm going to see you twice a day for 6 weeks, stuff like that.
I think it is very, very dependent on clinical goals and outcomes that you're looking for. And I think that's just something like to me and something I always at least tell my team and tell myself is like, am I making this plan because I think that's what they can afford? Is this what they need? And when I say need, like, what do I mean? Right? Like, are we going like full nervous system restoration, like full detox, everything? Or in our case, are they really wanting to come in to get rid of their low back pain and then we can nurture them into wellness?
But what do you mean by that, though? Which side of the coin do you fall on?
I think typically in the middle, right? Because low back pain can go away. Yeah, low back pain can go away in like 3 visits. But one from my own personal story, like I was like when I first got into chiropractic, I saw my chiropractor for 6 visits because that's what insurance allowed. And my back pain went away, but then it came back a year later. So really being in that middle and then having the anecdotal stories and like the case history to back that up. But if someone's coming in with low back pain or headaches and that's their main goal and their scans for the most part aren't terrible, we're not going to recommend 36 visits, right? So,
Yeah, I mean, I think for us, like our main goal is like one, how do we make enough change in the nervous system for a majority of the symptoms to subside? Because like it's hard like not being in a symptom based mindset of being like
mhm,
this is for this and this is for that. Like it all does tie to the nervous system.
mhm,
And so that's like from a chiropractic side. From a business side, like you have to get people results.
right.
And I always tell people this because like I totally understand like the whole concept therapy thing of like, hey, I'm going to put this image, like this idea into the subconscious mind so that it starts to elicit in the physical body. So like with Zach and I, like, I mean, we're like we're delts. And so like we are like really big into the whole like chiropractic philosophy stuff, but we're also like really well educated in the whole business thing. And so it's like, you have to acknowledge at some point somebody's pain points. Cause I feel like
Mhm.
if you just come out and be like, hey, your lower
I
back
don't care about
pain
how you feel.
your lower back pain's not even real. I don't care if your back hurts or it doesn't. You're subluxated and you're getting adjusted. Like
Yeah.
to that, I feel like that comes off kind of abrasive, at least in our demographic. And so like maybe like in Utah or stuff like that, like people are really receptive for that. Like for real. Maybe people are like really receptive to that. But I feel like in Dallas, like people are like really straight shooters in Dallas. Like
Mhm.
they don't want to be like beat around the bush. They're just like, yo, tell me what's up and how are you gonna help? And if I like you, then I like you. You know,
Yeah.
like
100%.
people really care about your personality and your experience, but they really want to be confident in you. And I feel like as we, if the doctors, if we don't acknowledge that person's chief complaint,
Mhm.
then we really miss that connection piece. Like we miss that piece of rapport.
Yeah.
And so like a lot of times in my report of findings, the big thing that I'll say after I go over the scans, and I say, listen, the scans are awesome and they're going to change. But my
Mhm.
biggest thing is that I want your baby to sleep better at night. It's awesome if the scans get better, and the scans can be perfect, but if the baby's not sleeping at night, then we need to continue to work on something,
Mhm.
right? And so it's like acknowledging that, and it's teaching them that the key to that the solution to their problem is the nervous system versus making the nervous system their problem, if that makes sense.
Right.
So, yeah, that's kind of what we do. Zach, I would love to hear, and I'll then kind of do the same for like our prenatal pediatric population. This is obviously not advice, so you be your own doctor and recommend the care that you want. But in your office, Zach, what do care plan? I would love if you would go through like your different common case types and what you typically care plan for those, and what and your reasoning behind them. Like, give me like your 3 most common cases that you see and your 3 most common care plan.
So 3 most common are going to be sciatica, headache / migraines, and then neck and shoulder pain. Neck and shoulder pain is typically going to be 20 visits. That's just what we have found to be.
And what's your frequency for that?
Frequency wise, we're going to be twice a week for the first 8 weeks, and then we drop down to 1 visit a week for 4 weeks.
Are you doing progress scans?
Yep. So on a 20 visit, we'll progress on the 10th and the 19th, included in our plans for everyone, not just for headaches and migraines or neck and shoulder pain. So we're going to do 20 adjustments. We're going to do 2 comprehensive re-exams. We're going to do cervical traction or remodeling. And so we get someone on a dental roll for the first 6 visits to work on forward head posture. And obviously I've gone over all of this with them leading up to this. We do one-on-one mobility training and then a little bit of soft tissue therapy. So that's all included in their plan. On top of other random things that we just don't talk about. But so 10th and 19th visit, there's going to be our re-exams, and then working in kind of a drip of mobility work to get them back in the gym or whatever their goals are. Sciatica, we're looking closer to like 24 or 28. 24 visits going to be 3 times a week for a month, twice a week for a month, 1 time a week for a month. And then the 28 is going to be twice a week for the first 3 months, and then once a week for a month. And that's really why, so like the 20 visit, I felt would get people pretty close. And then 24 wasn't necessarily enough, or that 3 times a week was a barrier of entrance, which is why we created that 28. So I would say most commonly for all 3 of those cases, pending scans and history, it's either 20 or 28. Yeah.
Nice.
What about you?
That was a lot shorter than I thought. What's your reasoning like behind that? Like what's your reasoning behind because this is a big thing, like especially in the prenatal peds world, is like wellness is like once a week is reserved for wellness.
Yeah.
So like what, I don't know, just tell me why you throw in once a week. Like why do you?
Yeah, it's a great question. It's something I've thought of quite a bit.
So what's your and then what's your wellness care look like? Why do you throw in once a week on the care plans? What's your wellness care look like?
So a big thing that I speak on with patients is going from twice a week to once a week. I want to make sure that their body is resilient and able to handle once a week. Very rarely have we like gotten to that once a week in a 20 or 28 and been like, too soon. But every once in a while, we have to add in a couple extra weeks at twice a week. But a big reason why is resiliency. And so I, want them to be prepared for wellness or maintenance work and want their body to be able to hold an adjustment for a full week and then recommend wellness on top of that. So our wellness, we have 2 options: once a week for a month or every other week. And I say for a month as in like
each month,
monthly pay.
How many people do you feel like that are on? Because I mean, everybody, it sounds like, goes to once a week in your care plans. How many people do you feel like choose once a week as their wellness option?
I would say it's when they first start, typically 80 to 90% start at once a week. And some people, they'll just straight up say, hey, my goal is in the next 3 months to drop down to every other week, but I don't feel confident. And I totally let that up to their decision. So I recommend, I say, hey, I get adjusted once a week. My family gets adjusted once a week, but totally up to you if you want to go every other week. But I would say 80 to 90% stay at once a week.
Yeah. I would say it's probably the same for us. I also give people the choice. I used to be like, it's either once a week or bust. Or like I would give them either one or the other. Be like, hey, I think every other week is good for you guys. I think that weekly is good for you guys. And then people just kept asking about every other week or vice versa. And so I just put them all on the same sheet. Just be like, hey, listen, like we have these family wellness memberships. It's available to your entire family. if someone else in your family needs a care plan, then obviously we'll give them the recommendations. And I tell this to people all the time, just to like let them know, like, hey, we'll see the rest of your family. And I just let them choose. I say, if it was me making this decision, like as your doctor, this is typically what I say, like, if I was making the decision for myself as the doctor, I would recommend probably this, just based off of everything that we see. I think it's going to be more beneficial for you to choose option whatever, A or B, what, weekly or every other week. And dude, sometimes like I used to really think like, oh, I'll just tell them every other week just because like maybe they'll afford it. They'll be able to afford it more. But like, dude, sometimes people are actually like good on every other week. Like there's some families that we've been seeing for so long that like you can feel them feeling the redundancy of getting adjusted once a week. And I'm like, hey, I think it might be time good for you guys to like switch to every other week.
Right.
And so sometimes people will be like, no. And I'm like, okay. And that's fine. But it's like, hey, listen, like everything is good. And like, this is working the way that it should. And I think as the chiropractor, like it should be our goal to get people to every other week. Cause that means you're doing your good, like a job. You're doing a good job of optimizing their nervous system to be able to hold an adjustment. Like, dude, if you're getting adjusted for like 2.5 years or something like that, then.
Well, I think too, it's not just like how good your adjustment is every other week or once a week, but also looking more at like, what does your education look like on top of that, right? So like, are we talking about the chiropractic lifestyle? And so that's typically if someone has been talking about and like showing signs that they're living a less toxic lifestyle, or they're on top of their emotions, they're physically recovering better from their workouts, those sort of things, then great, let's get you down to every other week.
Yeah, I mean, the point of the adjustment is not to fix a symptom, but it's to restore proper connection and facilitate the innate healing potential of the nervous system. And that is disrupted by the overload of physical, chemical, and emotional stress. And so if your life is overloaded by stress, physical, chemical, or emotional, I always say that like stress because people think it's like just stress, like, oh, my life is
Yeah.
busy. But they also don't think about like how they pick up Chick-fil-A every night. Or they also don't think about how they like, I spend 14 hours at the desk and I spend 8 of those hours on the desk on the phone.
Yeah.
They don't think about those things, or they're like, so I always make sure I clarify like physical, chemical, and emotional stress. Like where do we see an overload of stress in those areas? Yeah. And it's like, dude, that's the whole point of the adjustment, right? The adjustment is to help you manage life. Chiropractic is meant to help you live better, not just to clear out your symptoms. And dude, you can use it however you want. Like honestly, like dude, it really does disappoint me sometimes whenever people don't graduate to wellness, because like the whole goal should be to get on wellness and to stay on wellness. But dude, at the same time, I understand, dude. I just had this mom. She was like, listen, like this has been fantastic. I have 7 kids. And I was like, it's
Wow.
fair. Like fair, right? She's like, I stay at home. My husband is a pastor. Like,
Yeah.
you know, and I was like, I get it. That's fair. Like I can't hold that against you. Cool. Well, yeah, I think that gives us a lot of insight. Before you were doing the 20 and the 24 and the 28, what were you given before then? Like, have you always done that? You've been like, hey, this
It
is
was 24 and 36. And I just felt like it was such a big, like a stark difference between 24 and 36, because 24 was 3 months, 36 was 6 months. And so I never had that tweener, which again is why I created that 28. I really love it. I will say, and I think we've briefly talked about this. One thing that took me a while to realize, but shifting down to once a week, staff was not trained on from me, but staff was not trained on.
it's always from us.
Yeah, HR did not do a good job.
Hobie.
But one thing that I found once people transitioned to once a week, even on a corrective plan, was they would start scheduling like every visit like each week. So like if they came in on Monday at 5 o'clock, they wouldn't schedule that next visit until after their appointment. And that quickly allowed for a 3-visit plan to turn into 4.5, 5, 6 months, because they just weren't staying on that frequency.
Yeah.
And so we did a really great job of scheduling everyone to their first progress. And then it was like, okay, schedule whenever. But now my awesome office manager that handles the scheduling out, she'll just take them all the way through their care plan. And if we need to change it, we can, but she'll literally print it out each visit on a sheet for them. They can just take it with them, put it in their calendar once they get home. And so we're starting to see an actual 3-month plan takes 3 months. An actual 4-visit 4-month plan takes 4 months, which from a business side is super, super important.
That's
And
great.
just like result side too.
Yeah. That's pretty cool. Nice. Yeah,
What about you for the prenatal and the peds?
so yeah, I mean, we have in the prenatal peds space, you see kind of like you see the same people, like you see mom and baby mostly, right? Every now and then you'll get a dad, and sometimes I get kind of like, oh man, like I love whenever the dads are coming in because like for their wellness, but it's like when dad has a herniated disc, it's like, dude, like I'm not trying to, like, yes, I'm trying to get you chiropractic care, but like maybe not from me.
Yeah.
And so I'm like really quick to refer, which I'm super excited to refer because I really love the PT and chiropractic combo because like I just want to adjust you and like be done. But like I feel like a lot of times like they need, dude, like mobility, corrective exercise, and like all those kind of things. Like you really do need that, bro. And if that makes me a mixer, then I guess I am. Um,
I
like
think it's the lens that you're, I, I mean, I don't know if I just feel the need to like defend myself to the
oh,
straight
dude,
side
you're
of
a mixer,
practice.
bro. I'm gonna call
Yeah.
you out. You're
Yeah. I'm a
we're
big mixer.
stamping you, bro.
I
Nah,
mean, like the mobility for us, when I say that in our office, it's like, here's cat cow. Like it's so basic. Like as soon as people are like, hey, bro, like how can I get more depth on my squat or how can I improve my kettlebell swing? I'm like, that's a great question for our PT friend.
dude,
It's just
just
foundational
to have that
basics.
conversation, I think that if you are I think that chiropractors that think that the adjustment can fix everything, I
Yeah.
think that that's pretty ignorant. And I think that's bad. Maybe it's not bad. I think that it's just a disservice to your patient to because your patients look at you as the authority and the trusting figure, and if you convince them that like the only thing they have to do is get adjusted. Like I think the adjustment is the foundation of
Mhm.
it. But you have to eat well and you have to exercise. Like we talked about it yesterday. Like you can't just get adjusted and lose 50 pounds.
No,
Like your
chiropractic clinics would be busting at the seams.
bro, like like for real, but like I think that it is possible. I think anything is possible through chiropractic care. But I think that that the best chiropractors also know what else needs to happen not to support the adjustment. I think that you water down chiropractic when you say like you need to do this exercise to make your adjustment hold better
Yeah.
or like you need to take this supplement because I think that you say if anything supports the adjustment, I think that you also say that like the healing potential of the body is not perfect unless we have X. And I think that that's also wrong. So, like, I think that it's also false to say, like, your adjustment will not be as effective unless you do cat cows. But cat cows are also,
Right.
it's a thing that you have to do. You have to be able to teach, once your nervous system is working better, you also have to teach it to move your spine better. Like, you have to ingrain that neuromuscular patterning in there. Like, that has to be a thing. You have to exercise. All that being said, I really like it whenever dads who have disc issues see PT first and then they just come to us once a week for adjustments. That's what I really like. That's my favorite like dad case. I do that a lot and I'm really excited for us in our Argyle Wellness Center to have a PT in there because I can just send them all those people and it's gonna be
Mhm.
fantastic. We're gonna have the healthiest town in DFW in the South. All that being said, I think that's like we have to have that conversation around the philosophy of referring, really. How do you feel about that?
I'm like 100% with you. I think that's one thing I've started to consider is like with our extra room, like would a massage therapist be best or would like a PT that can take over a lot of that mobility work that I'm doing? Because as much as I love it, like I have a huge background in strength and conditioning, just like you, Spence, and can talk about all the different ways to exercise. I'd much rather adjust 200 people a day and stay on my chiropractic rug, if you will, than move over to the mobility mat.
Yeah, literally on
So
the rug.
yeah.
Yeah, dude, I think that honestly, like for acute cases, I love decompression for adults with back pain. I think it's
Mhm.
fantastic if it works for you. I also really like dry needling. I'm terrified of needles myself, but I think it works. I really like those
Yeah.
in conjunction with the chiropractic care. I think it's very helpful.
Mhm.
And we don't really see that many people. I say like, I mean, for every like probably 11 moms and babies that we see one dad like
Yeah.
that.
Yeah.
So yeah, and usually they all come after. Like the dads usually come in because they're like, I see how well my family's doing. My body sucks, and they're like, I need to take care of myself. But
Yeah.
all that being said, in the prenatal peds office, pediatric wise, what do we mostly see? One, we see a lot of we just call them like the chronic illness kid. So like it's not just ear infections. It's not just uh, we see like the chronic illness kid is like the kid that has eczema, that is always sick, respiratory, usually respiratory wise. They get the tummy bug a lot, or they have ear infections. In PX, they call them like the poor plumber, meaning that
Yeah.
like
Can't just
yeah, like their
detox well.
body, their elimination system is just like tanked.
Hmm.
So for those kids, bro, it really depends. Like that's what I think in the prenatal peds office is like it really depends on the age of the kid and the birth
Hmm.
history and how much medication they're on.
Right.
Because like you can have one kid that has ear infections that it'll get so much better in 18 visits, and then you have another
Hmm.
kid that has ear infections and they can go to the same school with the same age, but one of them can be a C-section and one of them can be a vaginal birth at home. And the vaginal birth at home will clear in 12 visits. And the C-section kid that was born in the hospital that was
Hmm.
fully whatevered, and they're both 2 years old, that's like a 36 visit kind of kid. Like all of the kids that we see that are conceived with IVF, this is anecdotal, so don't take it as gospel or anything, or there's no research behind it. But just in our office, what we see is the kids that are conceived through IVF, their heart rate variability and their nervous system is so much lower than the other kids. It takes a lot longer to stimulate their nervous system for healing.
Hmm.
And so, or the kids like with sensory issues that also have ear infections, like, so that's a thing. In the pediatric space, typically what we go over, like the way that we care plan is through intensity. So instead of being like this ear infections do best off of 18 or
Yeah.
stuff like that. It's through intensity of one, symptoms, two, birth trauma, and then three, outside influences. So like medication and other therapies.
Hmm.
So how much work is the nervous system having to do to combat whatever is going on? So basically it's like how much are we going to have to override the nervous system to make change happen? So if a kid is a home birth at home with like a beautiful like 45-minute pushing phase, because like really fast pushing phase is too fast,
Hmm.
and that we see a lot of issues, like usually those are babies with torticollis or those things. So like a really nice, like a really awesome, peaceful home birth with a breastfed baby, and baby's like 18 months old, but now baby is having ear infections and the heart rate variability is in like the 80s, and there's only like a couple of the like red bars on the thermal scan. That's like an 18 visit baby.
Hmm.
Now, if you have an 18-month-old kid, he was a C-section, he was in a helmet, he doesn't speak, he has eczema and gut issues, that's like a 40 visit baby.
Yeah.
So we kind of program based off of intensity in terms of our kids' cases. Our care plans go from 18 visits, which is twice a week for 9 weeks, 2 scans at halfway in at the end. And then we do 18, 24, which that's probably our most popular one, which is twice a week for 3 months.
Hmm.
And then our more intense cases start to get into our 3 times a week. So 28 is 3 times a week for 1 month, twice a week for 2 months. And then we have 36, which is 3 times a week for a month, twice a week for 3 months. And then we have a 40, which is 3 times a week for 2 months, twice a week for 2 months. And then a 60, which is 3 for 3 and 2 for 3. And those 6 months is like reserved for like our sensory kids, like our
Hmm.
nonverbal kids, GLP, just all language processing kids. So we
Yeah.
kind of ramp up based off of intensity like that, because
Hmm.
it really is kind of hard to have like it's either this or that.
Right. Right. I am always very impressed by the practices that like they have two plans. Like I think
Dude, it's hard, bro. Like, which I
it's
get it.
best.
Like, you could just sell, hey, you need another 12
Hmm.
at the end of 24, But like,
Yeah.
I don't want to have that sale again. And that's
Yeah.
just where we're at. I think for like wellness based chiropractic offices, like, dude, if you're like, I just want my baby to not be so tight. Those offices, dude, that's great, bro. Like a 12 visit plan,
Yeah.
bro. Babies are good.
Right.
Babies that respond really fast that we always that we typically will put on AIDs is like our latching, like tongue and lip tie babies. Typically, like that does a lot better, especially if you're working with a lactation consultant to help build the breastfeeding skills with mom. We'll typically do 18 visits for that. And our motor milestone babies, typically if babies are like 4 or 5 months and still not rolling over, within like 2 weeks, they'll start to like pick up on their milestones. And usually we just see them for 18. So for a lot of our babies who are like, everything is pretty good, but mom is like, something's not quite right, and they're like, we really want to get ahead of this, that's kind of where we see 18 visits happen. So that's how we kind of program our kids. Like each one of the kids really do get like a different kind of plan. Typically people in families have the same kind of lifestyle, so typically family members will have similar plans. But that's what we do for that. For our pregnancy care, I worked with Matt Morris a lot for this, because a lot of places are like, just put them on a care plan. And that's totally fine. You can totally put moms on care plans. But what we did is, especially because we really want mom to, one, value wellness for herself and for her baby. Two, pregnancy is really overwhelming for a lot of moms, and there's a lot of stuff that's going on. And they need the flexibility, because who knows, dude, if mom's like throwing up all day at 34 weeks and stuff like that, like how's she gonna, and like she has 2 more kids at home and she's pregnant with twins, and her husband is a pilot and he flies, how is she gonna make it in 3 times a week? Come on. So we have a pregnancy wellness membership. It's $60 or $65 an adjustment or something like that, which is like $260 a month. They come once a week, and then after 28 weeks we'll start to boost them up to ramp up the care. So the closer they get to their delivery, we'll actually recommend more care coming up toward their pregnancy.
Nice.
And our moms really like that, because it keeps it really flexible. So like, say baby is breech, then we can see them more often. And so that's great. But then if they're not, then they're good. And that gets them like really enrolled in like the whole wellness membership thing. And so they really kind of understand like how it works. And then so whenever we do the free consult and the scan and adjustment for baby, whenever baby comes earthside, then they're like, yeah, it's a no-brainer for me to come back once a week and bring my baby. So instead of putting people on care plans, I was putting people on care plans, and that was like a lot of work. And then like, what if you finish all your visits before, and then like, or what if you have visits left over? It just makes it like super simple if you just do a membership.
Yeah, I think that's super smart. I've done that just a couple times, like once or twice, for those that are like put that work in a pain-based clinic. We've had a couple of people like they just want to get prepped for surgery, whether it's like labral reconstruction, meniscus, whatever that might be. So we'll do more of a membership up to their surgery. So if they're like, I'm getting this in 3 months, boom. But again, it's happened like once or twice for us. It's not a huge thing. But I think that membership is super smart for that transitioning the pregnant moms, and I'm assuming their babies onto wellness for y'all.
Yeah, dude, a lot of times we'll have like mom come in like for her pregnancy care. And then we tell them like, hey, you're going to automatically be enrolled for your postpartum care into our regular wellness membership. So you'll be automatically taken off of our pregnancy membership. Your fee will go down to our regular wellness membership. And then if you would like to add the baby or anybody else onto the family plan, then you can do that. And dude, a lot recently, we've had a lot of moms be like, hey, I delivered the baby. And then mom, baby, and dad all add on to it, the wellness plan. And so that's been pretty cool.
Yeah. Do you ever just start someone on wellness? Like, do they ever just come in and you're like, nice.
Yeah, we did that for, dude, me and Kate, we like wrestled with this for a while, because at one point we were just like, let's just get people in the door. And because we were still trying to figure out like our whole sales process and stuff, because for a while it was just me. So like all of our systems and procedures were all based around me and the way that I say things, the way that I do things. But when you add another personality in there, it doesn't necessarily feel authentic like for everybody, because now it's like I'm trying to think, okay, what would Kate say here, and how can I have a congruent like experience for people like that? And so we had to sit down for a while and like really rework like our day 1 and day 2 and say like, okay, it's not just my practice anymore, it's our practice. And so like, what is the tone of our practice now versus just me? And so what we did for a while, bro, we were like, everybody's going on to wellness. I think one time we had like 27 new patients and they all started on wellness.
Dang.
And that's just because we're like, dude, let's just get people chiropractic care, bro. Like, who cares how much they come in? Like, it's better to get adjusted than not. But I think we were doing that out of a lot of sense of lack, being like, well, we don't want to be told no because there's a lot of new stuff going on. So let's just make it so cheap and affordable that everyone is bound to say yes. And then we switch to the opposite, where like everybody is going on a care plan. It doesn't matter if you've been adjusted from before, when you were in your mom's womb and you're 40, you're going on a care plan and you're coming in 3 times a week. And so like that was just like, dude, we're making it way too hard, because then people were like, well, I want to get my whole family on, but I can't afford to do my care plan, their care plan, my husband's care plan, all that stuff. And it's like, okay, well, it's like I can't give you 50% off of each care plan.
Yeah.
And so, dude, we just started making the decision, bro. It's like, is this a good wellness family or not? Or does this person need a care plan or not? And we just ran it through the filter of like, if this was my own mom or my own
Mhm.
brother or my own kid, like what would I put them on? Do they really need that?
Mhm.
And I think
Yeah.
one of the big things that clicked for me, I think about this quite a bit, but we had this mom, she went through a care plan. Her daughter went through a care plan, and they had signed her husband up for an initial visit, and the mom and the daughter were still on wellness. I had prepared the folder and I was just going to give the dad wellness, but he really needed a care plan, but I didn't think he was going to sign up.
Mhm.
And I was going to go into the report, and Logan told me, hey, the wife said that whatever you recommend him, just put him on the monthly payment option. And so just need to know what you're going to recommend him so I can set all that up. And I said, wait, really? And she was like, yeah. I said, oh, well then I was going to put him on wellness, but really he needs a 24. And so I went in there and he was like, great, done. And I was like, why am I like recommending care with my hand on people's pocketbook
Mhm.
all of the time? Like, because people are coming in not because we're the cheapest office, but they're coming in because we get the best results. And it's like, dude, I just need to make decisions from that place. It's like, dude, what do they need? And like, do they need it or not? And it's like the
Mhm.
same thing. Like I had a report yesterday. It's this like high school kid. He like messed up his neck, like back squatting, and he's seeing our PT friend. And I saw him and I looked at his scans and I was like, he does not need a care plan.
Right.
And I did the whole wellness spiel. Like you can pick like bi-weekly or weekly. And the mom was just like, we'll do whatever you feel like is the best recommendation.
That's I think like working with people, when you give them that recommendation, that when it's like this or that, they're like, well, what's the best one? And so they're
Yeah.
like, you've already guided them to somewhat of a decision, but they want that extra guidance of like, well, what's the best recommendation of the two options, which is always so interesting to me.
Yeah, dude. I think that in chiropractic, like, dude, like if you go to the dentist and the dentist is like, you need a root canal,
Mhm.
you're not going to be like, well, I mean, he's not going to be like, well, like we could just not do the root canal because I know that you can't afford it. He's about,
Yeah,
you either need it and you get it or you don't. And like, these are my recommendations. You're coming for me for my opinion. And I think that we as chiropractors like need to do a better job of giving people like legit recommendations instead of
instead of just
just like trying to say like what are they going to sign up the most for the sake of saying like, oh, I have a referral based high conversion cash practice. Who cares what your conversion percentage is, bro? Who cares how many referrals you get, bro? Do you help people or not?
right, because I know I've personally seen a lot of people from those referral type, high conversion onto wellness clinics, and you rescan them and look at everything. You're like, I don't know what's been going on because you're
Yeah.
not getting results.
Well, dude, and like we have an internal referral based practice. We
Yeah,
have a
for
high
sure.
conversion, high like to care and high conversion to wellness practice. At the same time, though, it's like those people should do that because we are building them value, and it's not because we're telling them like, if you don't continue with your chiropractic care, you're going to have disc disease, or
Mhm.
like if you like your kid's going to stop talking if they don't get adjusted, or like those kind of things, dude. So I think it's important to give care in the way that you feel that's in most integrity with you, bro. So,
Mhm.
anything
100%.
else to add?
No, I think it's if you're like just starting in practice and you're like, oh man, this is overwhelming, it's going to take time, right? I think that's a big thing too is if you are starting right away out of school and you don't have a mentor that can help guide you on making recommendations because you didn't do an associateship or maybe your internship didn't have that, um, that would definitely be a recommendation to get a mentor in that sense. But I think too, like if you're going through your internship in school, ask the doctor, like ask the person that you're under, like, why are we making these recommendations? Even if it's not the same model. Like if you're in a pain-based internship, but you want to be more pediatric prenatal, it's still nice to start to understand like, why is this doc that's been in practice for 20 years making these recommendations?
Mm-hmm.
You start to get a feel for that. So
Yeah, if you were talking to startup Zach, which I guess we're still in startup mode, you can maybe or maybe not. if you were talking to day one, Zach, like our episode one, Zach, and you could tell, you would only, and he could only give out one care plan, which one would you tell him to write up? If you could only recommend one thing, like, because like, let's say you're like, oh, I don't have a care plan based office. I don't give recommendations. People just come in whenever they want. And I want to start giving care plans. What would
I
the
would
one care plan you would recommend the most?
probably the 20. Yeah. It is the one I recommend the most. So either the 20 or the 28. Yeah. What about you?
The 24.
Yeah.
Yep. Twice a week for 3 months. That's probably, I feel like it's good all around. Not too much, not too long, not too expensive. Good results.
100%.
Yeah. Okay, guys, let us know what you're doing for your care plans and if you found this was valuable. But thanks so much for listening to the What Now podcast. We'll catch you guys later. Peace.
Peace.